Look 10 years ahead, what do you think the technician role becomes, and what really does pharmacy look like if we don't evolve?
I think one of the biggest things is I would like to see in 10 years all of the states adopting certain practices. Technician product verification is one of them. A handful of states do it. We call it 13 different things in 13 different states, but I think technician product verification is a big one. It takes the pharmacist out of the actual simply matching a label to an item. We have a lot of pharmacist burnout, and working in a large health system with hospital pharmacy, institutional pharmacy, specialty pharmacy, all the pharmacies you could think of, I see burnout in the pharmacist in every area of pharmacy. I think if this continues and technicians don't continue to advance, I think the burnout is going to get worse. I think the pharmacist shortage is going to continue to happen. You're not going to be able to get pharmacists. But I also think that it's not simple, but it's simple enough to say, are technicians a little piece of the solution to pharmacist burnout? Can technicians in your state, in your city, at your employer, at your institution, can technicians be part of the solution? And stop looking backwards to when they, the mindset of they're part of the problem and we need to educate them, isn't it? They are part of the solution, advance them, elevate them, advocate them. And if you're not, and I think that people are concerned about the level of advancement and the level of elevation for the technicians should or shouldn't be doing, my advice to them would be, if you're putting a technician in an advanced role and they don't do well or they fail or it's not successful, that's on you as an employer because you didn't train them well as to what you want them to be doing.
Let me say this clearly. Pharmacist burnout is a staffing issue. And before we can even fix what's happening with pharmacists, we have to fix the burnout with technicians. With technicians, it's not about giving more responsibility. It's very simple. It's staffing, a livable wage, and consistent hours. That's it. We don't need to add on more responsibility, more liability for a $1 pay raise. That's not what's happening right here. I'm a pharmacist, and when I think about why I get burnt out or why I get tired, it's because I'm constantly training new technicians and I don't have adequate help in the pharmacy. I'm having to do everything in the pharmacy versus having a very strong team that can help offload some of the things that we have to take on. Also, let's stop pretending that pharmacists are just matching a label to an item. That's not what we're doing when we're verifying. Even with refills, there are times where we catch duplicate therapies, drug interactions, and catch dosing issues that might not have been caught in the first time around. And so when we downplay the role of a pharmacist and devalue what we do, that is also going to hurt our profession. Even with technician verification, which applies to refills, we are still on the line for that. Our licenses are still liable, and just because something is a refill doesn't mean it was done correctly the first time.